Good afternoon, welcome to our Ezra system seminar series. Today we are very delighted to have Professor Zhang, who's visiting with us from Professor Zhang. He's a professor in the Department of Population and Community Health with the University of North Texas Health Science Center at Fort Worth. Actually, Dr. Zhang, and he's also a very close friend of mine, and I think my work related to, I'm trying to look at things from the built environment and the civil engineering and the environmental engineering, and we want to connect it to the health. Actually, Professor Zhang, he went even further. Actually, he's been looking at really trying to connect engineering and health with his background. Actually, he got his PhD from, I think, Michigan. In environmental health and also in the statistics. I think that's a very good combination. And before that, he got his training actually from Tsinghua University, which where I did my undergrad study. There, actually, Professor Zhang, he's serving in multiple roles. I know that he's associate editor for the Total Science of the Environment. And also, he is been serving, I think, as the secretary of, I think, Exposure Science, the Society of Exposure Science, which is so important. And I just want to share with you one piece of information I learned recently. If you think about your health, can you guess what percentage of your health could be impacted by exposure? And I was told that it's 80%. More than 80% of our health is actually determined by exposure rather than, even our genes or something. So that's why I feel that the topic today, air pollution and also extreme weather, these are all important factors that we're exposed to every day in our daily life that in turn impact our health. So without further ado, Professor Zhang, please go ahead.
Oh, yeah. Thanks, Dr. Dao, for his kind introduction. It's my pleasure to visit here and to share my research with you today. So let's start from the exposure assessment. So what's exposure assessment? So exposure assessment has two major components. The first one is human activity pattern. So what does this mean? This means how much time you spend at different locations and what you are doing. For example, sitting here, sleeping, standing, walking, running, because different type of activities affects our inhalation rate. So here I just using air pollution as one example. So the second component is location. Because different locations usually associated with different levels of air pollution. For example, classroom, your home, your office, in the car, in the airport. So different microenvironments. So we will have the terminology called microenvironment, basically different location. So different microenvironments, have different level of air pollution. So actually, my dissertation a long time ago, is actually interface between transportation and the environment. So my dissertation focuses on exposures and health impact due to traffic congestion. So this is the cartoon, my favorite cartoon, especially when I was a doctoral student. I use this cartoon many times. So here, I just want to show the conceptual framework of my dissertation. So let's think about this. So everyone has 24 hours in a day, right? So if you run into traffic congestion, that means you have to spend more time in traffic. But you only have the 24 hours in a day. So the first question, what time will you more likely reduce? So this is actually the first chapter of my dissertation. So traditionally, especially like the 1980s, 90s, we use survey to ask the human activity pattern. For example, this is also the common method in transportation and urban planning. For example, we will recruit a certain number of participants. So those people will be asked. For example, I can ask you guys, to record your locations and activities for a 24-hour period. So now let's think about yesterday, where you were and what you were doing. Then fill out like the form for the 24-hour period. Locations, multiple locations plus multiple activities. So this is a traditional way to, for human activity pattern survey or time use survey. So here, because this is a common use method, but here, if you recall your yesterday's location and activities, so can you recall all locations and all activities? So here, obviously, there's, the typical, like the recall bias. So the second thing is, pollutant concentrations. Want to know, for example, concentrations in this classroom, concentrations at your home, concentrations, in the car, in the bus. So we can have a bunch of options. We can use like some instruments to measure like the personal exposure. We can also use the modeling to model, the concentrations at different locations. So this figure from our recent review paper. So think about it in the real world. So we are being exposed to many environmental and social factors simultaneously. For example, air pollution, weather, green space, built environment, and social factors. So if you look at this figure, so let's still use air pollution as one example. So actually exposures begins in utero, and continue throughout our lives, from childhood to adulthood to the older adulthood. So this figure shows, the timing of exposure plays a very, very important role in the health outcomes at the late life stage. For example, exposures during the pregnancy period or exposures, during childhood probably have a larger impact, or maybe large impact on diseases at the late life stage. So now I want to talk about the green space project. So nowadays there's a novel biological aging indicator called epigenetic age. So this indicator is calculated using statistical models based on a set of demethylation biomarkers. So basically, based on your body biomarkers, we calculate a biological age. So the biological age represents the people's overall health. So the differences between chronological age and the biological age represent accelerated or decelerated the aging process. For example, someone looks younger than their actual age, or someone may look older than their actual age. So this slide shows, the so many diseases, risk factors, and lifestyle factors are associated with biological age. But here, for this project, we want to look at how long-term exposure to green space affects epigenetic age. So here's our hypothesis. Basically, we think, the green space exposure could affect demethylation, then change, biological age. So we leverage, a cohort study. Basically, for this, the cohort study, the participants, we follow those people for more than 40 years. So this, those participants are mainly from 4 cities: Oakland, California, Minneapolis, Minnesota, Chicago, and Birmingham, Alabama. So at the baseline, the average age of this, of this participant is 25 years old. So this figure shows, the timeline of this cohort study. Basically, we can divide the timeline into 3 stages. Stage 1, basically, is early adulthood, like you guys. So at this stage, most people are at low risk of CVD, cardiovascular diseases, because they are very young. So at stage 2, which is middle adulthood, so most of the participants are at moderate risk. Stage 3, which is older adulthood, so most of the participants are at risk. So as you probably know, so age is a very important indicator of lots of chronic diseases. When people get older, they start to have more and more, chronic diseases. So here we look at, 2 types of the green space exposure. One is based on parks, based on the surrounding parks. We look at, basically for everyone, we have their address information. We just draw a circle, like the 5-kilometer circle. We look at, whether there are any parks within 5-kilometer radius. We also use, the green space indicator from satellite, NDVI, to calculate, the percentage of green space. So for demethylation, epigenetic age, we use, the EPIC bit chip to analyze demethylation biomarker. We also use, a few epigenetic indicators, 2 second-generation indicator brain age, and 1 third-generation age indicator. So here's for our models. Basically, we have 3 types of models. Model 1 is a very simple model. We only account for age, sex, and field center. For model 2, we added individual level factors. For example, physical activity, smoking, alcohol, education, poverty. For model 3, we further add neighborhood level factors, like the neighborhood level deprivation. We also tried a stratified analysis by race and sex. Here I want to show some of the results. So basically here, this figure shows the results for 3 models: Model 1, Model 2, and Model 3. So for the original one, this means the results for park exposure. So those 3 are for like the NDVI-based green space indicators. Why we have 3? because we have the 1 year average green space exposure. We also have the 2 year, 3 year average green space exposure. So let's look at this one. So simply, having a park within 5 kilometers of where someone lives, so has a reduction in epigenetic age, roughly by half a year. So basically, epigenetic age is biological age. So if we look at this one, for every 10% increase in surrounding green space measured by NDVI, people had the average epigenetic age that was, the 2 and 6 years younger. So basically, the green space exposure can slow down the biological aging process. So here are results for black adults and white adults. So here we found significant association for white adults, but not for black adults. So one possible reason is that we look at our data, because for the black adults at the baseline, they have the lesser surrounding green space, which means they probably have the fewer opportunities for access to green space. So here are results for women and men. So here we found significant results for women, but not for men. So why is that? There are 2 possible reasons. One is because the traditional role of women as caregiver, they more likely access to green space like the parks. The second one we found in the literature. So some other studies have already shown the women tend to visit parks more often than men because of the purpose of the social interaction. So here we just want to show the potential pathway between built environment, green space, and CVD. So basically, one pathway is, green space can reduce environmental exposures, for example, air pollution, noise, and the temperature. The second one, parks, green space can increase physical activities. The last one is, so green space, parks can enhance the social interaction. So this paper was published in the Science Advances. Actually, a few months ago, we also published a 6th paper, look at how green space and blue space affects progression of cardiovascular diseases. So this paper was published in Circulation. Which is the best journal in cardiology. So now I'll talk about air pollution. I think here probably everyone use Google Map. You probably also look at some of the Google street images. So actually all those images are from this camera. So this is a Google Street View car. So this is a 360-degree camera. So we're very fortunate to work on the project. We put a lot of instruments inside this car. So when this car was being driven on road, so this car can also automatically measure air pollution levels. So fortunately, we have the measurement at more than 10,000 road segments in city Houston. So in this project, we are using we're using, so idea of this project, we want to build a very fine resolution exposure surface in Houston. So we want to build a model, prediction model. So so dependent variable is, air pollution levels. Here we use a lot of, indicators related to air pollution. For example, land use, industrial land use, commercial land use, residential land use, transportation, population density, and emissions. Here we use XGBoost to build our exposure models. So XGBoost, essentially is a decision tree. It predicts, the dependent variables by answering a series of questions. For example, look at this one, this tree. So, for like the binary variable, if answer is yes, go this way. Answer is no, go this way. For the continuous variables, this is a cutoff point. If the value is above a cutoff point, we'll go this way. If below a cutoff point, we'll go this way. The beauty of XGBoost is that it builds thousands of trees. So for example, look at here, this is the initial tree. The second tree is built based on residuals of first tree. The third tree was built on the residuals from second tree, and so on and so forth. So that's why this is called extreme gradient boosting method. For the final prediction, so it's actually based on kind of votes across all trees, all models. So this slide shows the model prediction performance from cross validation. For example, this is the particle number concentration. For the particle number concentration for nitrogen dioxide, for NO, so R square value above 0.9. For black carbon, the R square value is 0.87. For PM2.5, the R square value is 0.77. So compared to the traditionally regression models, so those models perform very well. So here we just use we just make the predictions at we divide Houston into a grid, 1 kilometer grid. For every grid cell, we make the prediction. Finally, we make those maps. Here we can see, for different pollutants, we have different spatial pattern. So this figure shows, a huge, massive chemical fire in Houston in 2019. So this chemical fire actually released thousands tons pollutants into the air. So right after this chemical fire, we set up a low-cost sensor network in Houston. You can see here from those are the circles. Basically, every circle represents one low-cost sensor. We try to look at how this chemical fire affects air quality in Houston, especially in those poor neighborhoods. I think most of you probably know 2023 Canadian wildfire, because that affects the eastern coast a lot. So we also use a lot of models using data from epidemiological, purple air sensor network, and human mobility data to predict exposures during the Canadian wildfire. So here I want to, talk a little bit about extreme weather. So let's think about a fundamental question: how hot is too hot? So in your mind, how hot is too dangerous, or how hot is too hot?
38 Celsius degree.
38 Celsius. Yeah. Okay. So other thoughts, other comments?
Depends on the humidity.
That's also a great point. Temperature, humidity.
Depends on the age group, right?
Oh yeah, yeah. Mm-hmm. You want to say something?
Like 98 or 100, yeah.
Okay, great. Yeah. So basically, different people give me different, different answers. So, and also if you ask people in Phoenix, they probably feel 100 degree, Fahrenheit is very common, right? It's very common in Phoenix in summer. So actually, look at this. The figure. So actually, just for weather parameters, a lot of weather parameters affects our exposure and our perception. For example, think about in the summertime. So if you just stand under the sunshine directly, or if you stand under a tree, your exposure will be different. Or think about if you stand outside or run outside without any wind, or with some of the wind, your exposure will be also different. So basically, a lot of weather parameters affects our exposure to heat or cold. So in my field, traditionally, when we look at extreme heat or extreme cold, we're mainly using two variables: temperature and humidity. Because many studies have shown hot and wet weather is more dangerous than hot and dry weather. So the reason is that because we traditionally use a lot of regression models, even a lot of weather parameters affects our exposure. Because those weather parameters usually have the moderate or high correlation, we cannot put so many correlated variables into regression models. A long time ago, when I was a postdoc, so actually we probably the first group to use machine learning in our field. Basically, we put all those weather parameters into our model using random forest. Because random forest can handle correlated variables. Here, I just want to share one very interesting finding. So when we look at weather forecast, for example, using our phone, right? So we usually will see like the relative humidity. But here in our study, we found actually absolute humidity is more important than relative humidity. So what is absolute humidity? It's just the actual mass of water vapor in the air. Yeah, actually we found some evidence from animal studies. For example, like the influenza. So also some studies found the actually absolute humidity is more important in terms of the spread of influenza virus compared to the relative humidity. Okay. Yeah, so these are published papers, just in case you are interested in the details. So this is also a very fun project. So most of us check weather forecast very often. The question is, do you know how weather forecast is generated? Is that science? So do you know how forecast is generated? So do you know?
I have no idea.
explain about general circulation models, GCMs, is part of the model is like a huge interconnected different models of different sectors, atmosphere, water sector, soil and ice, and other part I don't remember what was that, but like millions of equations, physical governing equations are related to each other, so that the temperature can be good. I think, it happens with satellite imaging. We start with satellite imaging, have some data, and after that we just capture. That's what I know.
Yeah, great. Yeah. So other comments? Do you see something? Okay, so actually the weather forecast is art and science. Here I'll tell you why. So basically, those are forecasters in the National Weather Service office, those guys. They got all kinds of information from weather station, balloon, satellite, radar, and a bunch of numerical models. So for the numerical models, which is basically exactly what he said, a lot of numerical models. So here's the question, or a problem. So if you look at the output from different numerical models, they will give you different answers. For the normal days, that's okay. They may have like a 1 degree, like a temperature difference. That's probably okay, right? However, during the disasters, that may be a problem. Should they issue a warning or shouldn't? Because if you issue like a warning, actually, especially for like a hurricane, flooding, that will cause a huge potential, the consequence. So actually, for those a lot of warnings. So another thing that to think about, if they issue too many warnings, so what will happen? So that will be, we interview a lot of people in the National Weather Office, because that will be the crying wolf. Because too many warnings, we won't trust you, right? So that's why the process is kind of the art and science. So that's why in this project we look at how forecast uncertainty affects heat wave warning system. Okay. So this is also a very fun project. So for the farmer workers, think about us. Summer outside is very hot. Most of us probably just stay inside with AC, right? But for those guys, they have to work outside, and they have to work very hard. So we have done very interesting project. Look at this one. So this looks like a pill, but actually this is a temperature sensor. We can use this sensor to measure core body temperature. So basically, the people, including us, we can ingest those pills. Then we can measure, the core body temperature, which is very fundamental for many diseases. Yeah, fortunately, we have done this project in Washington. Okay, this is also a very interesting project. So nowadays, most of us have the smartphone, right? And most of us, installed a number of apps. And almost everyone, didn't read agreement in details, right? Whenever you want to install app, there is a very long agreement. So regardless, a lot of apps actually collect our location information. So some companies, they purchase those location data from thousands of apps. Finally, they compiled several nationwide data sets. I think one famous one from the SIP graph, you probably see some applications during COVID period. So what does this data set can tell us? So basically, for example, there's the Costco supermarket here, or maybe Whole Foods, right? We can look at, for example, how many people went to Costco or Whole Foods yesterday, or where they came from. Maybe 20 people from the campus, maybe 100 people from another zip code. So here, in the U.S., so now we know obesity is a very important, public health challenge. A lot of obese people in the U.S. So one issue is about food environment. Traditionally, a lot of people using the neighborhood food environment for calculate from CDC. So the idea is that we look at every neighborhood, or maybe zip code. We count number of grocery stores. We also count number of healthy grocery stores. Then we calculate the ratio. We use this ratio to represent the neighborhood food environment. However, for some people, for example, they like Costco, they like Whole Foods, they like Trader Joe, they probably want to drive a few more miles to purchase food. So fortunately, we combine the traditional food environment, geographic location with the human mobility. Because nowadays, this data set is huge, represents roughly about 10% of US population. So here, I just want to share, one interesting finding. Actually, this, so this came out as a Nature News. So basically, on average, Americans tend to drive like around 6-7 kilometers outside their neighborhood to buy food. So finally, I will talk about exposome, because as I mentioned in the beginning, in the real world, we are being exposed to many environmental factors simultaneously. Air pollution, green space, built environment, food environment. So here, just so here you just the correlation matrix for the exposure indicators. Here we use the distance to the shore, green space, PM2.5, other pollutants, food environment, temperature and weather. So here, so this project, we link exposure to proteomics. So what's the proteomics? Basically, it's just like other like the omics. We measure thousands of proteins in our body. So we found, so the for this study, we found a lot of exposome pattern associated with cardiometabolic and respiratory diseases. So finally, I want to thank all my collaborators and the students and funding agencies. I'll stop here. So any questions?
Any questions?
Oh, go ahead.
Thank you for the presentation. I'm so curious about how much you go further in connecting with private sector in designing their own business plans, maybe because you gave us many examples, and each example gave us many business ideas about maybe we can something differently. So have you ever did some kind of communication with other private sectors after this?
Not very much. Yeah, but actually, I mean, I think that's a great question. So I think in the future, I think ideally for the health, for sustainability, the ideal scenario is that we have the win-win situation. For example, one time I was trying to work with the insurance company. So the idea is that because we feel like, for example, if we can do something which can benefit, potential patients, general population, and the insurance company. So insurance company probably more likely to fund our project, maybe work with us. For example, I think he mentioned, for wholehearted to heart, because this varies by age group. For example, elderly or people with pre-existing diseases are usually vulnerable to hot weather. One idea is that we're thinking, have less apps. So, we can work with hospitals. They can issue those, patient-specific message to the patient, not just a generally heat wave warning, because someone probably will ignore that, right? So if we can tailor those messages for different, group, that's probably, I think from the insurance company perspective. So if we can reduce the hospital visit from those people, they can also save a lot of money, right? But this is a long way to go because it's not very easy, to work with, the companies to have an actual, solution. But I think that's the future.
I have another thing. The idea of green space reevaluation, spatial analysis for green space of the ratio for parks or green exposure, and linking it to the grocery stores, I think you can have a new reevaluation of real estate value, like land value, and I think it will give customers something like customized human-centered land evaluation, like which neighborhood is good for you to go.
Actually, I think in effect, it already. For example, if you want to buy some houses, usually like the lake view, ocean view houses, have the higher price, or maybe for example in New York City, the apartment, houses closer to Central Park usually have the higher price, right?
I was really fascinated to hear about your green space analysis and using exposure to green space as a predictor for what we call the epidemiological age.
Yeah.
And as I was listening, I couldn't help but just sit back and think, oh my gosh, comparing the effect sizes of green spaces versus exposure to highways versus exposure to power plants. Is your team headed towards spin-offs these days? Are you looking at other factors, or are you primarily focused on green space?
We actually work on a number of factors. So I think now, but in past few years, we spend more time, efforts in green space. We feel this probably, for example, like the air pollution, right? So if you work on some of the green space projects, for example, if you can persuade, like the city government to plant more trees, it will be, probably a good, mitigate solution, not only for air pollution, but also for like the, for noise, for heat, and also for physical activities. Yeah, so that's why I'm in recent few years, I'm kind of high on green space, especially here, I think because for example, like the climate, because climate research is very important, but usually funded by the the government, right? So I think green space kind of maybe a good need to work on, and also scientifically. I think green space, there are so many open questions on green space. For example, like the air pollution, ozone. Ozone here, ozone in San Francisco, ozone in Phoenix. So it's the same molecule. But green space here, green space in West Coast, East Coast, and the South are different. Different trees, different vegetation, and also some parks are maintained very well. Others don't, right? Yeah, I think a lot of research questions are very important. Yeah, but now I feel scientifically there are more open questions for green space.
I have a question. Yeah. Okay, this is great. So as you've been doing this Exposome research for decades, where do you see now as a frontier of this kind of work? Where's the frontier? And then it seems to me, a lot of work has been focused on really building the association. Right, and then some might be able to build some causality, like between built environment and the outcomes. But mostly it's kind of exploring the relation between the built environment and the health outcomes. So when I'm going where is the frontier in terms of the scientific research? And my next question is, where are the actions, for example, based on the work of your community, and what would you tell the three stakeholders, like the general public, the city planners, and then even the hospitals. So because one key question I have on mind is really, we have all these researchers, because many of them, when they graduate, they'll be researchers. They're going to do all this scientific research. So how are we going to be able to translate all this research into action, and where do you see the gap?
So both are great questions. So the first one, I think now the one frontier is, the kind of causal relationship. So unfortunately for lots of human studies, most of human studies are observational studies. For lots of potential confounders, factors, there's no way to measure. So this is one thing, we're trying, for example, for air pollution is different. Air pollution research has been conducted for many, many decades. We got a lot of evidence from human studies. Most studies, the association-based study. But meanwhile, we also got a lot of study evidence from animal models. So that's why, it's very hard to build the causal relationship between environmental exposures and the health outcomes. Usually we have to done a lot of epidemiological studies and animal studies. Then we got all those evidence to make the causal inference. For some the unusual scenarios, we could do some of the natural experiments. For example, there may be the new the lead trail, right? There may be for some cities they may be plant a lot of trees. For those cases, we could have a natural experiment. So we can get more information on the potential, the causal relationship. Because for the actions, the first thing we need to need the causality. Then we can take the actions. So the second question, I think actions are very, very important. Actual actions, especially for the population, sometimes it's kind of very challenging. Because we usually, when we do research, we usually, take, mainly focus on few parameters. But if you want to translate your finding into the practice, impact the society, impact the population, usually you have to work with, for example, a lot of stakeholders, government agencies, communities, maybe the hospitals, maybe the insurance companies. But this, based on what I know, I could be wrong, because this is very, very hard. Why is it very hard? For example, how can we change or modify regulation? So you probably see, you may have seen a lot of studies from different groups. They may work with different stakeholders. So as I know, most studies don't involve a lawyer. But if you want to change, the regulation, some policy, it's very important to have a lawyer involvement. So that's why it takes the time, takes a lot of efforts. You have to educate, for example, officials, right? You have to educate, communities. I think now, I think it is working on towards this direction. So that's why now more and more like the community-based studies. Basically, we want to, translate, the research finding into the practice. But I would say, it still takes a long time. Takes a lot of efforts, because you need to educate a lot of, communicate, with a lot of people with different backgrounds. And sometimes, this is not, is not very easy. Need, a lot of involvement. For example, like the community organizations. It takes a long time to build a relationship between us and them. And also, they usually have different perspective. But I think this definitely is a direction. Now, how can we, better communicate our research? How can we, actually, impact the society? How can we take, more action? So that's why I'm really looking forward to working with, the people, for example, Lex.gov in the engineering department. As you probably know, for some problems, we don't have to wait until we understand all the mechanism, biological mechanism. So we could, take some actions, before we fully understand biological mechanisms.
Great, thank you. Any other questions? Let's give our speaker another round of applause.
Thank you very much.